This podcast is going out to all of those parents, new moms out there with younger children, and you might have questions around their dental care, around what to be looking for, around preventative steps you should be taking. And if that's you, then friend, we have an awesome episode lined up. Welcome back to another episode of Your Mouth Matters. Dr. T is in the house. We are recording today for all those new parents out there who have questions around what they need to be doing from a preventative standpoint and what to do if an issue comes up when it comes to the dental health of their younger kids. Dr. T, how you doing?
Hey, I'm great. This is a topic that's near and dear to my heart since I have an almost 2-year-old now, and I'm excited to go through all of the things that I've figured out along the way. Definitely having my daughter has helped open my eyes even more. But I think that this type of information is so not really put out by pediatric dentists or pediatricians. So yeah, I'm really passionate about this topic. So
yeah, I was going to say this topic, we somehow find our way into this conversation on, 65% of the podcast or something. We get on this, we'll go down a tangent on this, or it's connected. So this is more of an overview episode. We have a lot of things we want to go into on a more in-depth, but this is a good starting spot, right?
I got a lot of patients that come in. People bring in their 1-year-olds or their 2-year-olds. They have some concerns. They've noticed some things. They're maybe not getting answers from other dentists. And so this podcast is really just like overview. Hey, these are the things that you should be looking for. These are the things that I'm going to recommend when you come in. And by listening to this podcast and then being your own detective at home, there's probably a lot of things that you could actually pursue and do first before you even come in to see me, even though I do love to see the little guys. But there's just so many things that you can be aware of as a parent that, again, like your pediatric dentist may not be really aware of or telling you. So let's just dive in because get to the good stuff. Okay, so the one of the questions is always like, when should I bring my baby in to see you? And the answer to that question is on the way home from the hospital would be great. The reason I say that is because a lot of babies struggle with birth trauma, especially if they're born C-section. There's a lot of pressure on the head and the neck that can alter the cranial bones, that can affect the spine, which later is going to impact development. We also see a lot of babies that are born vaginally. They are going through this very tight birth canal, and depending on how much time they're in the birth canal, that can change the cranial bones, and that can also impact the growth and development of your baby. One of the really big things that we see is we're always screening babies for tongue ties and lip ties. And the fascia underneath the tongue, again, can be very, very tight based off of the birth or the pregnancy, or even genetics can play a role in this. So when I say I want to see that baby on the way home from the hospital, the things that I would be looking for would be, does the baby have a tongue tie? This could affect the baby, their latch, their ability to get milk. We focus a lot on that with babies, like with lactation consultants and the breastfeeding part, which is really important for facial growth and development and nutrition. But tongue ties and lip ties are also linked to facial growth and development. So when that baby is 2, 3, 4, 5, 6, through all of their growth, most facial growth and development happens before age 8. So when all of that's happening, if you have a tongue tie or a lip tie that's really restricting and preventing proper function, that's actually gonna alter the way the face grows. And when the face is not grown properly, we worry about issues like airway problems, snoring, sleep apnea, TMJ issues, and all the other health issues that go with that. So you can bring your baby in ASAP. We can evaluate for those tongue ties, lip ties, and there's very, very minimal intervention that can be done if we identify that there's an issue. There's really cool laser treatments like baby lays, oral lays that helps release the fascia. Doesn't necessarily mean you always have to cut. Sometimes you do, but even if you do have to cut, it's very, very minimal. We use a laser. It's very easy. Okay, so that's the first thing. The other thing is a lot of parents come in because their baby's teeth are starting to come in, and now they're starting to notice some maybe brown spots or white spots. Enamel has got there's different variations based off of the mineral content in enamel. So sometimes if you see like a white chalky lesion, like a white chalky spot on a tooth, that can be the start of mineral leaving that tooth, and that can be a sign that there might be some imbalance in the way that the teeth are remineralizing. You also can see, so the white spot lesion will transform. If it continues to progress, it'll transform into more of like a golden brown lesion. And so if you start to see those things in your baby, then there are several things that I'm always going to check for. So number one, we have to look at the gut health. So I really like a company called Tiny Health. They do a stool test. I did this on my daughter when she was 10 days old because I'm totally a dork. And I was like, ooh, I want to see, I want to see what's happening with her microbiome. The microbiome takes several years to fully develop. And when they're little guys, this is really when you have the most impact on setting them up for a healthy gut. So if you do the Tiny Health test, that will show you what kind of microbiome there is. We're going to do a whole other podcast with Tiny Health that goes into more detail on this, but it will give you a really good idea as to what kind of bacteria are there, and then is there going to be absorption issues? You need certain bacteria in the gut to help facilitate those minerals getting into the body. So if things are going in, but they're not getting absorbed into the body, then we're going to be deficient. Even if you're eating a really healthy diet, even if your breast milk is really nutrient dense, you're still going to have an issue because of that microbiome. A lot of C-section babies have issues with this because when babies go through the vaginal canal, all of the good gut bacteria come and get recruited. And so when the baby comes out, they're covered in all this good bacteria. And then, of course, they're licking their hands and hands go in mouths. And that's how the gut gets inoculated. A C-section baby doesn't have that. They're starting to do more inoculation for C-section babies. But that's one of the things that we always want to screen for is starting out with a good, healthy gut. If there is an issue, the Tiny Health will help you identify what kind of probiotic to take and what different things that you can do. Like my daughter's test came back, one of her tests came back, and they had said, you need to add more cinnamon and garlic into her diet. So I started like cutting up pieces of garlic, stuffing them in a raspberry, and she was eating raw garlic. She was like 6 or 7 months old. So they'll give you like cool, like natural things that you can do diet-wise to help shift that microbiome if they identify there's an issue. So that's huge. I also highly recommend Weston Price. Weston Price was my Bible basically when I was pregnant and when I was breastfeeding and when I would start to introduce foods to my daughter. I followed Weston Price like almost to a T. And Weston Price, we've talked about this in other podcasts. Weston Price was a dentist that traveled all over the world in the 1930s. He went to primitive populations and he found that these people had no cavities, they had no periodontal disease, they had big white arches, they had no teeth that were crowded, and he attributed that to their nutrition. And he went out to all different areas and basically figured out what the common denominator was and the foods that they were eating. And what he found was that they had high fat, always animal fat, protein. They were eating organ meats. They didn't have processed sugar. They didn't have processed flours. So anyways, the Weston Price Foundation is an excellent resource. They also have a raw milk formula, which is very, very similar to breast milk. A lot of the formulas that are on the market, most of them have no cholesterol and very little fat. But when you look at breast milk's got a very high amount of cholesterol and high amount of fat. So Sally Fallon has developed a formula with another MD that basically mimics breast milk, and they recommend raw milk. So you can go to their website and you can read about it. There's also a book. The book that I loved and that was my Bible was by Sally Fallon, and it was Nourishing Traditions for Baby and I think Baby and Child. So go get that book. I still have that book in my kitchen, like ready to grab, and follow that book. That will really help set your baby up nutritionally so that they have the building blocks so that they're getting the nutrients, they're getting the minerals, they're getting the fats to be able to like grow a healthy body. A lot of the times, because our diets are deficient in things and because we're eating more of this white man processed diet, we our bodies are just chronically deficient. And as a child is trying to grow and develop and all that, if you don't have those building blocks, then you're not going to probably grow so well, or things will be compromised. So that's I can't emphasize how important nutrition is, especially in babies. This is the one time in their life that you have 100% control of what they eat. So as soon as they are 6 months or whenever they're ready to start eating, give them those nutrient dense foods. I know that there's a lot of talk about baby led weaning, and I do like the idea of baby led weaning, but I believe that babies, because you have this window of opportunity where they're going to eat whatever you put in front of them, that you should take that. And so purees, I think, super nutrient dense. With my daughter, I'd make bone marrow, I'd grind it up with an avocado, and make a puree, and I would spoon feed her. She was eating liver, she was eating egg yolk, all of these things that are softer that in a baby led weaning type of situation would not really be options, because baby led weaning is more about the baby feeding themselves, and they pick up a spear of avocado or something and kind of mush it around. And I think that exploration is really cool. And I did a combination with my daughter, but you got to make sure you're getting those really nutrient dense foods in. Okay. So you got to have kind of a hybrid model. Chewing is really important. Most of our kids these days don't chew because the foods that we have are softer. And chewing is going to stimulate the muscles in the bone, and that's going to help the jaws grow properly. So in babies or young kids, we typically see there's three main types of dental issues that we always look at in dentistry. So one of them is periodontal disease. Usually not an issue with kids. Okay, they might have gingivitis, gum inflammation, but they're not getting like bone loss. Like they're not going to have that more advanced type of issue with their gums. Okay, so usually with kids, that's taken care of if they're brushing properly and they're getting the plaque off and all that. But the things that we do worry about in kids and we see more often are cavities. And then we also see teeth that are crowded. And both of those things are things that are preventable. They're things that you can treat. Okay. Nutrition, like I said, super important. Gut health, super important. Lip ties, tongue ties, important for facial growth and development, but also for cavities. When we look at a baby, we want to make sure that baby is breathing through their nose. Okay, so that's one of the things that you can really see very early on once you come home from the hospital, or go look at your baby when they're sleeping. Is their mouth open? Is their mouth closed? If their mouth is open and their jaw's back, that's a sign that there could be an issue going on with either a tongue tie, a lip tie, or there could be some kind of food thing going on where their adenoids or their tonsils are a little bit inflamed and it's causing them to be congested. So there's sometimes we have to figure out what is going on. Milk and gluten tend to be the most inflammatory foods. So if you're breastfeeding and your baby is congested, you may want to try cutting those things out of your diet and seeing if that changes things. But we always want the mouth to be closed, because if the mouth is open, it's going to do a few things. One, it's going to dry out the mouth and it's going to cause more of an acidic environment, and that's going to make the cavity bacteria thrive more. And number two, if they have their mouth open, when you open your jaw goes down and back. And so when the tongue is not resting up in the palate, when it's not suctioned up in the palate, it's not putting pressure on the palate and stimulating proper growth. Okay. So what does a properly developed face look like in a baby? Baby teeth should have spaces. You should be able to fit a nickel in between all of the teeth. And a lot of parents don't catch crowding in baby teeth because they're so tiny. And so they'll come in and they're all touching each other and they have these beautiful little Hollywood baby smiles. They look beautiful when they smile, but then when the baby teeth start to fall out, the adult teeth come in and they're crowded. So you want to be looking for spacing between the teeth. If you don't see spaces, then you are definitely probably going to need an pre-orthodontic intervention like expansion or myobrace or something like that, which we do a lot of here.
That's one that if you catch early, the intervention is way easier.
Yes. And so one of the things that I got my daughter started on when she was 6 months old is I started her on a Myo Munchie. And we have them here, but you can also order them online. And basically what a Myo Munchie is it's like this little silicone, medical grade silicone thing, and they chew on it. And it's like a pacifier alternative. And they chew, and the chewing stimulates that jaw development and growth. And a lot of kids, I'm always like focused on the why behind things. If your baby is attached to a pacifier, now babies before age 1, they I don't mind a baby using a pacifier or sucking a thumb or whatever. Even up to age 2 is okay, as long as it's not chronic. As long as it's not like that pacifier has to be in their mouth every minute of the day or they're having a fit. If they need a pacifier or a thumb to put themselves to bed or soothe themselves when they're a little bit stressed out, that's fine. But if your child is walking around with their thumb in their mouth chronically all day long, or they have a pacifier, and if you take the pacifier away, it's just all hell breaks out, like all hell breaks loose, then that is a sign that there might be something going on with a tongue tie or a lip tie, or maybe there's something going on with their gut health. What happens is we have a little spot behind our front teeth on the top that when you rub it, it actually releases endorphins. It feels good. The tongue naturally should be up there, should be touching on that spot. When there's a tongue tie or when there's mouth breathing that's happening, that tongue is not up there. And so what happens is the babies feel this need to get those endorphins, and so they will go to a pacifier or their thumb to get them. And so that's why they want that. Other things that you can look for: no baby should be snoring. No baby should be making really any noise when they're sleeping. They should be very, very quiet. If babies have a hard time sleeping, if they're tossing and turning and they're just not great sleepers, this is another sign that you might want to check for tongue tie, lip tie, that there could be some tight fascia that's going on, or there could be a gut issue. If you can identify these things early on, you're going to set your kid up for way, way better health. And not just oral health. I'm a dentist, but the gut is so important when it comes to pretty much everything. Any kind of health issue you can link back to the gut. An airway that's properly developed is going to serve you for your entire life. The airway, oxygen is the most important nutrient. So if you can identify some of these things early on and we can correct them, it's much easier to correct them, but it's also just going to set them up on day 1 for being just so much more healthy. So the reason why we do all these podcasts and all these comes back to this whole breathing and all that sort of thing is because it really is all connected. If you're breathing through your mouth, if your baby's got their mouth open and their jaw is more protruded because they have a tongue tie or a lip tie, then that's going to cause the mouth to become more dry, which is going to cause the cavity bacteria to take over, which is going to cause them to have more severe decay. See, it's all linked together. And then if they have more severe decay, then you're going to intervene and you're going to do fillings and all of that. But if you don't fix the cause, which is the mouth is open, the breathing is an issue, the acidity in the mouth is not good, then you're really just putting out fires. We have to make sure with kids, the most important thing is that their nutrition is on point, their gut health is good, and they're breathing the right way. And that's really what it boils down to. We have to do whatever we need to do to get to those things. And tonsils and adenoids can become inflamed because of mouth breathing and because of an inflammatory diet. So those are things that usually you don't see in little babies, but as your kids get older, like if you're listening to this podcast and you're like, oh my gosh, my child is 4 or 5 and they're snoring and their mouth is open, all of these things I'm talking about still apply to that age. And again, I would love to intervene in a baby when they're little, itty bitties. But if you're just identifying this in your 4-year-old, 5-year-old, there's still a lot that we can do. There's a lot that we can do to help get them back on track. But you have to remember that most of these things, the microbiome, you got a couple of years, the first couple of years of life for when you're going to make the biggest changes. And same with the breathing. Most of that facial growth is happening before age 8. So the sooner you can treat, the better. If you have a teenager, that we can still help them, but it just becomes harder to do. So anyways, and then the other question I get, which we've talked a lot about in another podcast, is what kind of toothpaste. I don't think any babies should be doing fluoride at all. In fact, if you're If your infant is a formula baby and you have them on tap water, that's actually too much fluoride. That is too much fluoride. And there are studies that show that actually is just feeding fluoride, tap water has fluoride with formula, can actually overdose your babies and it can cause issues. So make sure that if you're doing formula, get the formula get the fluoride out of the water, get a filter. Reverse osmosis is usually the best to do that, or you can get bottled water, make sure there's no fluoride added. And then I really like Dr. Jen's toothpaste because I don't want to have to mess with my baby accidentally swallowing something and then now I have to call poison control. So the things that we should be putting on our babies' mouths are like clean things that they can eat. We as moms, we buy like the organic food and we buy the soap that doesn't have scent and it's like safe for bottles. And then we buy like the laundry detergent that doesn't have a perfume. And we do all these things. And then we give our baby fluoride toothpaste. That doesn't make any sense. So make sure that you're feeding your baby something that they can eat. And I like Dr. Jen's because it's a 10% nanohydroxyapatite toothpaste, nanohydroxyapatite, very, very safe. It's in our bodies naturally. And you don't have to worry about your child swallowing it and having it be an issue. And it's actually as remineralizing and more protective to the teeth than fluoride. You don't need fluoride. There's no such thing as a fluoride deficiency. If your child has decay and your dentist is telling you, oh, you need to do fluoride treatments, that is a sign that something else is going on. Like there is an issue with their gut, their nutrition is off, or they may have a breathing issue and a lip tie or a tongue tie. So we have to look at those things because if we ignore the root cause, if we ignore the root cause, then we're just putting fires out and you're not actually going to be making any big changes. They're going to have cavities or whatever, probably their whole life. So anyways, I hope that was helpful. And like I said, we'll do more podcasts that kind of go more into these topics more individually. We have several podcasts already that talk more about them. But I did want to do a kind of a quicker podcast just to send out to all those parents that call my office with their babies, with their 1-year-olds. And I think if you listen to this, you'll come in with great questions and I can help. You can do some of this stuff at home before you even come in, and I can really help them be more of a guide for you instead of educating you when you're here. Because I want to make sure that the time that you're in my office, I can really help you figure out the problem and that we've laid the foundation already.
I love it. Yeah, thank you. This was super insightful and a great checklist almost for all of our new moms, new parents out there to go through as they're trying to either troubleshoot an issue or if you're just concerned and you want to be on top of it and really embrace that preventative. This is a great starting place so that when you do come into the office, you have an idea about some of the things that maybe you've already identified from listening to this or things that you want to go deeper on, that we can use this as a great starting point. So Dr. T, always appreciate having you share your insight, your passion, and make a complex and sometimes controversial topics more clear, more simple, and more easy for our parents to go out and take some action on.
Awesome.
I love it.
Thanks, Barry.
All right. Thanks for being on the show. We'll catch you on the next episode of Your Mouth Matters.